Oh, this is already ready to go.
Yeah.
Recording.
Okay.
Stop
Can
recording.
I see this?
Oh, yeah, sorry. It's already recording and it won't let us stop. I think when you put this in, it's automatic.
I'm gonna put it more farther out. Cause I think if we're going over like an emotional log, like it's fine if it's just make sure you're in it so she can see you in the video too.
Okay. Am I in here? Okay. Hi, good afternoon. How are you, Giselle?
Hi, I'm doing okay.
Yeah, how's everything been going since we last checked in?
You know, I've had a little bit of anxiety, but other than that, I was able to bring in the anxiety log that you asked me to do.
That's great to hear. Thank you so much for bringing in your homework. Now, you mentioned that you've had some anxiety. Can you tell me a little bit about that?
Yeah, so there was like, I don't know, I feel like, you know, I have a hard time going outside and being outside, and I think it's really rough on my mom and my family. I feel like my mom kind of tries to like peer pressure me into going outside, but she doesn't get it. She doesn't get that like I can't, you know. And I don't know. I guess it's just like that gives me a lot of anxiety. I feel very pressured by her. I don't like being pressured or like I don't like being forced to do something I don't want to do, especially like if it makes me feel really uncomfortable. Because to her, she just doesn't get it. She doesn't get it. You know, to me, I just can't, and she just thinks it's like in my head.
Okay, that sounds very overwhelming and very tough to have to, you know, confront, but also have to, you know, sit with that uncomfortability. Could you tell me a little bit about the times where you feel you're being pressured? What exactly is happening when you feel that she's peer pressuring you?
Like how she peer pressures me, or like what I
Yes.
feel when she
kind of like, you know, what's happening in the situation with mom, and then also, you know, I know you mentioned that you feel very uncomfortable and you feel, you know, the peer pressure. Could you help me understand what you may physically be feeling?
Yeah, so it was kind of happened the other week. You know, she wanted me to go on a walk with her. She was really stressed out and she just wanted to take some company, but I was like, no, like I couldn't do it. And she like tried to like kind of like guilt me into it, you know, telling me that like she feels stressed and she needs me, and it's just, you know, I couldn't do it, and that's where like the peer pressure comes in. And I guess like I just like felt very like I had said like uncomfortable, but also like, you know, I start kind of feeling like even the idea of going outside kind of like makes me like my chest kind of like tight. So I felt it in my chest, mostly. Yeah, I would say it was mostly my chest, which just kind of tightens up because I think it's just the thought of being outside and, you know, having a walk and all of that. Yeah.
I'm so sorry to hear that this is something that happened over the last week since last time I've been able to see you. And now I know that you mentioned that you've been experiencing this chest tightness. Have you practiced anything that we've gone over as far as like any breathing techniques? I know you mentioned the ones in the past that you learned with the last therapist, and we didn't really get to touch too much on those techniques. And you just mentioned that you do a lot of deep breathing. Have you noticed those have helped you in the moment?
I have tried. It's just sometimes like I'm so overwhelmed that I forget to like try them. You know, I kind of just get lost in my own head about it. I guess like it just consumes me, the anxiety, right? And it's hard for me to remember. Oh my god, wait, I can, you know. So I haven't like tried it while I'm actively like feeling really anxious. But I have like tried it like before bed and stuff, and it's been helping.
Okay, now I know and I see here with the log that you completed it, and thank you so much for that. In the moment that you're experiencing the anxiety, especially with the anxiety log, are you completing that one when you're in the moment feeling anxious or afterwards?
Afterwards.
Okay.
I'm kind of able to look back and see how I was feeling, and I kind of just write it down.
That's great. That's great. So as far as completing the homework, there were no challenges?
No. It's just, you know, as I kind of wrote it as I felt it. after like, looking back at how I was feeling.
Okay, and when you had mentioned this situation that occurred in the past week with your mother, when you had felt that, you said you felt that you were peer pressured and you felt very anxious, would you be able to rate that anxiety on a scale of 0 being, not so anxious, and 100 being, the most anxious you've ever been in your life? Kind of thinking back of the anxiety
Yeah,
log.
so 0 to 100. I would say like a 96.
Wow, you're very, very
Yeah.
anxious. That really was bothering you. I'm so sorry to hear that.
Yeah.
What was going through your mind in that moment when you felt this way?
It's just the idea of, being outside, like with other, like even bumping into other people, and like, I had mentioned that like experience that happened with that dog, and that's something that I'm also like really afraid of happening, and just like all of that comes to my worst case scenario kind of just comes to mind. I think that's why I'd say 96, because it does feel like if I go outside, this is all gonna happen.
Okay, so that thought right there. And I want to try something new with you, if that's okay.
Mm-hmm.
What I want to do is I want to take the thought we're having that you just mentioned, being able to say that if I go outside, this is going to happen. And I would like us to look at that thought. And then I would also like us to identify, based on the sheet that we went over, sorry, my apologies, let me grab our sheet. I had an extra from last week that we went over the 10 forms of our twisted thinking.
Mm-hmm.
I would love to look over this form and just kind of point out one that your thought kind of aligns with.
Okay.
And then I would like us to find a way to rephrase it.
Okay.
I think this would also help in assisting changing the thoughts that we're having, in hopes that we can also help change the way that we feel in the moment. Is this something that you would like to try?
Yeah, I'd be open to doing that.
So if you'd like to go ahead and write in the first box the thought that makes you feel upset. So I know we mentioned if I go outside.
Mm-hmm.
Little space.
Okay.
All right. So next we're gonna go ahead and use our sheet here, and we're going to try to look for one that matches. If I go outside, I am going to, be anxious. I'm going to
Be around lots of people, and I'll run into a dog and it will attack me.
Okay, so if I go outside, I am going to be around a lot of people and run into a dog and it will attack you.
Yeah.
So we have our all or nothing thinking. What do you think? Does this feel like it would fit into that category? This is kind of seeing things black or white.
Yeah, I would think so. It also sounds like maybe like jumping to conclusions.
I agree.
Right.
I agree. The fortune telling, maybe?
Yeah.
Being able to predict the future.
Yeah, I remember this one from last week. Yeah.
Yes. Okay. So we're going to put fortune telling. Alrighty. And now, what exactly are we predicting that's going to happen?
I'm gonna get attacked. And
All
I'm
right.
gonna automatically
Let's write that right
be
there.
around so many people. Under fortune telling?
Yes. I just want to make sure that we have it identified here.
It's just I'm gonna get attacked by that.
Yes.
Okay.
And then now we're going to look into a way to rephrase this. So we want to say what we want to say, but without the distortion. Do you have any ideas on how that might sound?
Okay, what's a distortion?
So the distortion is when we were doing our thinking and we were fortune telling, and we're telling ourselves that as soon as I go outside, we're going to be around all of these people, and then we're going to run into a dog, and then I'm going to get bit.
Oh, okay.
So could we think of a way to say that without predicting an attack?
I'm gonna go outside and walk with my mom.
That is a really good try. Let's start with the first part. I'm going to go outside.
Yeah.
So I'm going to say what you want to say, which is if I go outside, I'm going to be around a lot of people. And in some situations where there's a lot of people, there may also be an animal, and specifically a dog. And when we're in social settings with animals, especially dogs, there's a chance that the animal could get agitated and it could possibly bite someone.
Okay.
So what you're feeling and thinking is not impossible. It does exist. However, what we're wanting to do is say how you feel, but without predicting exactly what may happen that we're not sure is going to happen.
Okay.
So what you're saying is possible. There's an animal, there's a dog, and there is a chance that a dog could get, agitated, get aggressive. However, we want to help you, move past being able to, being in these social settings and not thinking automatically right away, I'm going to get bit, I'm going to get attacked. And the only way we're going to do that is by also being able to express how we feel. How you feel, like I said, there is validity in it. This is a possibility. It's happened, before. You have your own lived experience, and you've been through this before as a young child. However, we want to keep our goal in mind and all the work that we've done, and that is working towards getting you to go outside, go on that walk with your mom. And like I mentioned, I just want to be able to help you learn how to express yourself and say these things, but also not live in that fear.
Okay. Well, can you help me?
Yes.
This one? We can do
Right.
it together?
Yes.
Okay.
So next, we'll move into rephrasing. So in this portion, essentially what we're wanting to do is say exactly what you want, but without fortune telling, without predicting that you will be attacked. And the way that we could go about that is when we think about going outside, what else could we see?
Well, I'll see the tree in the front yard.
Okay, so you have a tree in your front yard.
I'll be with my mom.
Okay.
Right, so she'll be there. I'll see the cars.
Okay. So just starting out small, just being able to step outside of the door. So to put this together, how do you think we could say this?
So when I go outside, there may be others outside along with their animals, but I'll also see trees out front. My mom will be with me, and I'll see cars. So there'll be other things outside, not just potentially the animals.
Yes,
And the
correct.
people.
That's a great reframe, yes.
I didn't even think about that. All I thought about was the dogs and the people.
Yes, and I know you mentioned there's a tree out front. Tell me about the tree.
Yeah, it's big. You would think that orange trees are in the backyard, right? But no, we have one in our front yard. And, some people, sometimes there's those kids in the neighborhood that come and they steal some oranges, but it's fine because, we like sharing, so it's okay.
That's
Oranges.
great. And then maybe one day you'll be able to go out and grab an orange from the tree yourself.
You're right. I could definitely do that. I'll bring you one.
I would love that.
All right.
Right. So, just checking in on the homework. Was there anything else that you possibly wanted to go over? I know we've done our thought log. just kind of thinking about the anxiety, writing about it. We've done our feelings thermometer. And I love that you've been doing that. It looks like you've completed it at least 4 times a week, like I've asked. Thank you so much.
Of course.
And beyond that, you said there were no additional challenges?
No, just that experience I had, and
Okay.
it kind of triggered my anxiety. But other than that,
Okay, you'll be able to get to take these home today.
Okay.
Just so you can look over them. We'll review these and practice these a couple times each week.
Okay.
But however, moving a little along into the session, just trying to work on some things that we have aligned with our goals. What I was thinking today is just kind of we reviewed our homework, reviewed what we've learned. You were able to identify a couple of different symptoms of anxiety that you feel before it's coming on. And today I just wanted to work on maybe some new grounding techniques.
Okay.
I have one called 5-4-3-2-1, and I also have a deep breathing technique. I know you mentioned earlier today that you didn't really have one that you could lean on, in a moment of distress. So I really want to focus on helping you out of these times where you're feeling stuck in distress and anxiety. And that one is box breathing. Would you like to try those today?
I'd love to, yeah.
So the way that will look is I'm going to educate you a little bit about them, why we're doing them. Then I'm going to show you how to do them, and then we can try them together.
Okay.
And then afterwards, we'll just kind of touch bases on how the session went, how you're feeling, and then talk about homework we have for next week. How's that sound?
Good.
Alrighty, so let me grab, you have your journal here, so we're going to flip over here. And I'm actually going to kind of just draw it along here for you.
Okay.
So we're going to start with our 5-4-3-2-1. I'm also just getting your square ready for our box breathing. So 5-4-3-2-1 and box breathing are both different techniques, and my apologies, are different techniques that we utilize in moments where we want to help regulate our nervous system.
Okay.
So 5-4-3-2-1 is a grounding technique. It's to help bring you back to baseline when you're feeling anxious, when your thoughts are racing and you can't, calm your brain, calm your mind. Kind of just helps clear your mind a bit. It helps allow you to induce relaxation, no stress. So the way that works, it's going to be, 5 things that you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste.
Okay.
So just looking around us in the room, what are, 5 different things that we can see?
The board.
Okay, we have our board.
The chair.
We have our chair.
The orange juice.
Orange juice.
My notebook.
Your notebook.
My log. My water.
Your water, that's 5. Yes, correct. And then next we're going to move into 4 things we can touch.
Oh, okay. The table.
The table, how does that
My
feel?
hands are sweaty.
Your hands?
It's fresh. It's
Okay.
very fresh. My pen.
Okay.
I'm writing. My jeans.
Oh, your jeans.
My jeans.
Are those a different texture?
Yeah.
So it's not smooth like the chair or the table.
No, it's like they're like more textured, I guess.
Grainy feeling maybe?
Yeah.
Okay.
Grainy feeling.
And then one more. What's one more thing we could feel?
My chair.
Your chair, how does that feel?
It's plastic, hard.
Okay.
Yeah.
And next, 3 things we can hear. Oh, I heard something right
I think my.
there. That's 1, okay.
Another thing I can hear. Actively, or can I make the noise?
You can make the noise.
My nails tapping.
Okay, tapping nails. Your chair. What else can we hear?
I'm breathing.
That is very good. 1, that's very good. Breathing. All right. And then that's kind of the point of what this also allows us to do is focusing, being mindful in the moment. 2 things we can smell.
kind of just smells like nothing.
Nothing? Okay, let's think.
Like fresh?
What about your paper? We have a paper here.
You want me to sniff it?
Let's try smelling your paper. Is there a smell?
Yeah. It smells like paper.
Okay, so we have one smell.
Paper? Like maybe like ink?
Oh, okay, that's
Mhm.
a smell.
Mm-hmm.
And then you mentioned you have juice or
Water.
oh, it's water. Well, water doesn't have a smell.
No, it doesn't.
Okay.
But I had some liquid IV in here. Let me see.
Oh.
Liquid IV.
Okay.
Smells fruity.
It's fruity. Okay.
Mhm.
What fruit do you think that would be?
Like lime. Oh, is that a
Mm.
fruit? Lemon.
Yes.
Yeah.
And then, well, one thing we could taste.
Oh, my water.
There you go.
Mhm. I had a granola bar before this. The flavor's still in my mouth. Like chocolate.
Okay, so how do you feel now?
I guess more present. Like now I'm more aware of myself and where I'm at. Yeah.
That's great. And that is what we use 54321 for, is to help bring us out of that state of distress and bring us more back into that state of mindfulness, being present.
Like concentrating on like something else. Like,
Yes.
okay, that makes
So it's
sense.
a great way when your mind is focused on, let's say, like the situation that happened with your mom and you felt very peer pressured and you felt uncomfortable. That would be a way for that racing thought of, if I go outside, this is going to happen. A way to bring you back into the moment that you're not outside, that you're inside, that you're safe, and that you're okay.
Oh, I like that. Okay.
Thank you.
Okay, yeah.
So the next technique that I want to try, like I mentioned, the last technique is a grounding technique, and it's helpful to help regulate you in that moment of distress and bring you back into relaxation. However, I think pairing it with box breathing, which is the deep breathing that actually helps push on like your digestive system and your nervous system to help bring you back into being regulated. It helps lower that stress, lower your anxiety. And honestly, it's just a great therapeutic tool that we like to utilize. Just really, getting us back to baseline, especially when we have a lot of those racing thoughts, a lot of anxiety, a lot of distress. So the way that box breathing works, we actually breathe in for 4, we hold for 4, we exhale for 4, and then we hold for 4 before breathing in again.
Okay.
So the way that would look is, I'm going to model that. So I'm going to breathe in.
Okay.
So I did 2 breaths with box breathing, and I personally feel a lot more relaxed. I feel any stress levels that I had previously before breathing alleviated. Now, this technique does not work for everybody, and it does not work instantly for everybody. Personally, I like to go a couple of different rounds with box breathing. I'd love to start with you and just kind of see how you feel.
Like, do I want to try it?
Yes.
Sure. Can you count?
I
I'm
can.
more of a. I don't think I could do it.
Okay, and what would you prefer me to do? Would you like me to move along and count with the pen and the paper?
Yeah.
Okay.
Could you I'm really good with visuals. Can you label inhale what
I
we're doing?
can, yes.
I feel like that'd be easier for me.
Of course, I understand. I actually had to do this a couple of times to learn myself.
Okay.
I went to seminar training to learn these different techniques.
Okay.
So
Can I close
first,
my eyes?
you sure can. First, get into a state of comfortability. Relax your body.
You're
put
counting.
your water.
You're counting, right?
I am counting.
Oh, I'll get my water here. so I'm
Okay.
more comfortable.
And then once you're in a state where you're physically comfortable, close your eyes and we'll begin. We're going to breathe in, inhale, 1, 2, 3, 4. We're gonna hold. 1, 2, 3, 4. We're gonna exhale slowly. 1, 2, 3, 4. We're gonna hold. 1, 2, 3, 4. Inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. And you're done.
That was nice.
Yes.
Yeah.
How do you feel?
Definitely like kind of relieved a little bit. Like I wasn't thinking about anything but your voice. So that was nice.
So would you say that you were able to get out of the moment of maybe feeling anxiety or distressed and being able to be more just present in the moment, like you
I think
mentioned?
so. I think because I think the other activity, like I felt present, right? So I think I was already in that space. And like this, like I said, like I was able to concentrate on your voice, and that helped me. So I really liked that. It was kind of a little bit hard to read, not gonna lie, but like I liked it. I think it takes, like I think I would try it again.
Okay, great. Now this is something that you can do at home. One thing I love about these two different techniques is that you can do them anywhere. You know, you don't have to feel embarrassed, you know, especially when you're doing 5, 4, 3, 2, 1. No one really knows what you're doing.
Right.
So, you know, you could just be taking a walk around the house. You know, I know sometimes you're doing school online. And I'm sure maybe at moments online where you feel a little overwhelmed or stimulated, you could, you know, take a little break, distress yourself in the moment, and no one will know what you're doing. As well as, you know, with the box breathing, just finding, you know, just a safe space where you could do that.
Yeah.
Okay, and then, so I'm glad to hear that those two techniques really worked well. I can't wait for our next session. You know, hopefully I'll be able to provide you a couple more different techniques. I know that you mentioned you like the box breathing, so I have a couple more we could try next time. And then I just kind of wanted to go over just the session and just what we've done here today. We went over, you know, just how homework's been and challenges throughout the week. We mentioned, you know, what happened with mom this week and how we can kind of approach that and just, you know, reframing our own thoughts. And hopefully I'm hoping that these two techniques we learned today, you're able to utilize in those moments. I know you mentioned in the beginning that when you are feeling really stressed and anxious in that moment, you're not able to, you know, regulate your nervous system. And that's why I really focused on these two techniques to help in those moments of distress, so you can, you know, not stay stuck feeling anxious. Along, you know, with the anxiety log, which I think is a great practice, and I think that's something if you'd like to continue doing on your own, you can definitely do that, and you can still bring it in. We can always go over it. And is there anything else in the session that you feel like we did not address that you were hoping to address?
No, I think I'll definitely try I like the box breathing, and the grounding technique. I really like that. I can try doing this. This one was a little bit harder for me.
Okay, just restructuring or reframing our thoughts.
That was a little hard. So
that one is very challenging, especially you know, as it's a new skill and you're learning how to do the reframing. When I first learned this technique, I struggled for a while too, you know, just learning it. So it's definitely a normal feeling. And that one we can also do in session and practice in session. So anytime you maybe have a thought that you can't get rid of and it sticks with you for the week, definitely write that down. We can go over it and do that together.
Okay.
All right.
Okay, that'd
And
be
then
helpful.
just some of the homework that I wanted to go over for the week. I would like to try, you know, these breathing techniques and the grounding techniques in any moments of distress, any moment throughout the week that you feel this way. But I'd also like to use, you know, our anxiety log to go ahead and log it at least, you know, twice a week.
Like when I use them?
Yes, in moments that you're using them, like you can go ahead and describe the situation, what happened, and then, you know, how you felt in that moment, the thoughts and feelings you experienced. and then just, you know, what did you do next?
Okay.
Did you use one of the techniques? Did it work or not?
Like how I felt.
Yes.
Okay.
And then we could definitely go over that.
Okay.
And we're just gonna log this 2 times a week for the next 6 weeks.
Okay.
And then additionally, I think that's it. Your log is yours to take home.
Okay.
How do you feel now from the beginning of the session to now?
I feel better in terms of like say if I get in another situation with my mom where she tries to like peer pressure me, which probably will happen because she always does that. I feel like now I would know where to kind of like look to calm myself maybe, which is like I like the box breathing, so I feel more like I can do more things to help myself, you know. So yeah, I think I feel better.
Okay, I appreciate that, and I also appreciate the hard work that you've done in bringing in your homework, completing the homework as well, and just, you know, giving it a try.
Which is hard because I already have my own homework.
Yes, I know it's really hard. I tried this week to reduce our logs to twice a week. I know you have a lot of homework with it being virtual, so I did keep that in mind. I'll also make sure I work into our future sessions just a little more familiar support, you know, from your family. I really just want to appreciate you just for showing up, just for coming in, you know, trying these new techniques, trying out different things that, you know, might help. You know, it's not an exact science. It's not you know, one size fits all.
Yeah.
Not every skill will work for everyone, but I do appreciate you just coming in here and trying it, and like I said, mentioning that you do all the homework and you bring it in. And then other than that, I will see you next week at 6 o'clock.
Yes. Yes. Awesome. Thank you.
Thank you. Have a great night.
Bye.
Bye.